Okay, so the last two lectures are going to focus on the genus Clostridium tetani, and then the last lecture will be Clostridium botulinum. Clostridium tetani causes what we refer to as tetanus. Clostridium tetani, as well as Clostridium botulinum, are both soil microbes. Okay, soil microbes that have evolved to form endospores. Remember, endospores were that panic room, that perfect protection. So, soils dry out, the bacteria for these endospores, which are pretty much bulletproof, and they wait for water to come back, nutrients to come back. That's their normal habitat. We humans, well, turns out we humans are not where they want to be. We are a dead end. We're not exactly where they want to be. We're not exactly what they want to be in or growing on. Clostridium tetani produces what is referred to as a neurotoxin. The neurotoxin is called tetanospasmin. Tetanus is the neurotoxins interacting with the motor neurons of the body. They affect the neurotransmitter release and reuptake. So remember, when it comes to a nerve impulse at the neuromuscular junction, the impulse comes down the neuron, hits the terminal end of the neuron, and it will trigger the release of acetylcholine. Acetylcholine will flood across that very microscopic gap between the neuron and the muscle. As it floods across, it will then come into contact with the receptors, the acetylcholine receptors on the muscle, triggering the muscle response to the neural impulse. Here's the thing. Once acetylcholine has been released, well, it either has to be reabsorbed, taken back up by the neuron, or it has to be enzymatically degraded because you don't want that impulse to keep going. You want your brain to be able to send down an impulse, and then within a microsecond later be able to send down another impulse. Well, if the acetylcholine stays in that synapse, you're going to have a continued firing and a continued response by the muscle. So what tetanospasmin, this toxin, does is it inhibits, once that signal goes down, jumps the neuromuscular juncture, causes the muscle to contract. Well, the muscle never is able to reset. Okay, that signal stays there and it continues to tell the muscle to contract. So that is where the paralysis associated with tetanus comes from. Usually it starts the jaw. You'll see people who have tetanus, they get that locked jaw. Their lower jaw, the masticator muscles flex and they can't get them to release. And it'll seem to spread through their body. The muscles in the back will start to contract and they can't get them to release, and they will actually start to arch their back backwards. You'll see that the arms and the legs will start to draw up as the muscles contract and will not release, and it's extremely painful. You'll also see what is referred to as the rhizus sardonicus, sardonic grin, as the muscles around the mouth start to pull back, and it's almost this Joker-like smile. It's all the muscles in the face, the jaw, the neck, the back, their trunk, their extremities all start to contract and continue to contract, and it is extremely painful. because all those muscles will, as they're working against each other at maximal contraction, will start to tear. Joints will start to get, pulled apart. Death can occur. Most often, the death paralysis is because the respiratory muscles stop functioning correctly. The diaphragm, the diaphragm, those muscles will clench, causing the person to breathe out. The muscles in the ribs that help the rib cage expand for drawing in the breath, those contract, and so it's hard to breathe in. Tetanus exposure is, well, it's weird. Okay. Most people here in the U.S. are going to get a tetanus vaccine, okay, because we're constantly getting scratched, poked, things like that. I remember as a kid, a neighbor was building a garage, and for that 4-month period he was building his garage, I was constantly stepping on nails. I was stressing that tetanus vaccine because that's usually how we get it. It's a wound. It gets into a wound. There was a report, I forget how many years ago, a woman out west was riding a horse, was riding up and down the sides of a mountain, and coming down around a turn in the path. And turns out a branch had broken, it's fallen, and it was sticking up, had dirt on the end of it, and it jammed into her leg. Minor wound, very small. Put a Band-Aid on it. A few days later, she's suffering from tetanus, because that's usually what it is. Okay, it's not every time you're going to get stabbed, every time you're going, jabbed, stabbed, step on a rusty nail, dirty nail, any of. Okay, it's not every time this happens you're going to get tetanus. There has to be endospores on the soil, embedded within the dust on the rust of the nail, things like that. And there has to be enough that gets into you to establish a colony. Remember our steps of an infection. Just getting in, have to begin colonizing, have to be able to get around the immune response, all this stuff. So there has to be a certain number. Nobody really knows what that number is, I don't think, of spores that have to be able to germinate, that have to be able to establish. And what's interesting is, even though there's a soil microbe, Clostridium, tetanus, and botulinum, they're both anaerobic, okay? And it turns out our tissues, even though we're aerobes, we breathe oxygen, have lower oxygen levels than what's in the air we breathe. So these spores actually do very well. The bacterial, the vegetative cells actually do very well in our tissues. Once they're there, other enzymes and stuff they're excreting that would normally be used to break down soil particles starts killing our tissues. Causes the tissues surrounding the vegetative bacterial cells to start to decay, become necrotic. Blood flows in, blood doesn't flow out, blood pools, blood starts to clot, blood goes bad, cells burst open, and you literally become a soup. That wound becomes a soup for bacterial growth. What they're doing, though, as they're also growing, increasing in number, is they're releasing technospasmin that will diffuse from the wound site out into the surrounding tissues, then gets into the blood. So as you see here, the picture of this gentleman, his mouth is starting to get that rictus smile, that Joker-like grin. And the technospasmin toxin allows for the neuromuscular signal to go through, causing contraction of a muscle, but it does not allow the complementary signal that says to relax. So if you think about it, all the muscles in your body, in your arm, your legs, your trunk, are counter to each other. They allow for flex, they allow for, our arms to bend, move back and forth, okay? To bend your arm, the biceps. To straighten your arm, the triceps, But if you get both of those flexing at the same time, contracting at the same time, the bigger muscle will win, so your arms will bend, but there's going to be lots of pain, and there will be tissue tearing at the muscular level. The ligaments, the tendons will be strained. Very painful. So, low incidence here in the US for this nowadays, because you ever show up in a hospital, ER, one of the things they'll ask you, when was your last tetanus booster? Every 7 years. Boom, boom, boom. They want you to have it. Less than 7 years if you happen to be, doing stuff. Oh, it's been 5 years? Well, let's go ahead and do it now while you're here. So that has kept tetanus here in the US at lower levels. Other areas, other countries that are not as up to date on vaccinations for this, you'll see this is occurring very often. This is not one that travelers really have to worry about. Previous, neurological diseases, if they travel to an area, they may get it and bring it back. Here, because we vaccinate so heavily with this one, as long as the patient is up to date on their vaccine, we're usually pretty good on this one. It's when they lax, they let it go for more than 7 years or so, we start to worry about them. If a patient has allowed it to has been lax, they have allowed it to exceed the 7-year period that we like to keep everybody within, or they just didn't respond very well to the vaccine. They just didn't mount a very strong reaction. And you got to keep in mind, the vaccination isn't towards Clostridium tetani, the cell itself. It's actually towards the tetanospasmin toxin. So we're actually mounting an antibody response to the toxin. So if the toxin's in the bloodstream, the B cells will be activated. The B cells will begin an overproduction of antibodies. The antibodies will bind up all the toxin in the bloodstream, and then your macrophages and neutrophils will then clear out the bound up toxin. Your immune system on its own, along with penicillin G and other things, will remove Clostridium tetani from your tissues. Now, if you happen to be a clinician and somebody presents with the onset of tetanus, the locked jaw, they're starting to show the rictus in their face as it fixes, and their neck and all that, IV and immunoglobulin anti-tetanospasmin toxin, and then high dose of penicillin G intravenously. For the normal patient, just the normal, hey, we're going to give you the booster, infancy, 1 to 3 months, and then every few years you start to get it again. What they're going to do is just give you a booster that is what they call a toxoid. It's the parts of the toxin, okay? As a whole, toxin is damaging, but when it's broken down into individual parts, does absolutely nothing. It's inert pieces of proteins and whatnot. That's what they inject you with, okay? There has been some changes, as your textbook points out. For me, old school, it was every 7 years. Every 7 years you have to have the booster. Now they're changing it up a bit, maybe up to 10 years. But the 7-year thing, just to make sure you don't let your immune response lapse, because those B cells are not that long-lived.